Welcome to Bipolar Talks, a space where we explore the lived experience, science, and truth behind bipolar disorder. We're so glad you're here. Let's take a deep breath together and mindfully step into today's episode. If you find our content valuable, please like, comment, subscribe, and share this episode with others who might benefit. Every bit of engagement helps us grow this community of awareness and understanding. Episode title: How long do bipolar episodes last? Let's dive in. Section 1. Understanding the nature of bipolar episodes. Bipolar disorder isn't simply about highs and lows. It's a cyclical, often lifelong condition marked by episodes of mood disruption. These episodes can take the form of depression, mania, hypomania, or mixed states. Each of these has its own duration, intensity, and presentation. Some people may experience very distinct episodes with long periods of stability in between, while others may move between episodes more rapidly. It's essential to understand that no two individuals experience bipolar disorder in exactly the same way. What might be a short hypomanic spell for one person could turn into a prolonged mixed episode for someone else. That's why understanding the typical length of episodes and what affects them is so vital. It helps people with bipolar disorder, their loved ones, and even clinicians better recognize what's happening and how best to respond. So, how long do these episodes really last? The answer depends on several key factors: the type of episode, the presence or absence of treatment, individual biology, lifestyle, stress levels, and more. Let's begin by breaking this down type by type. Section 2. The length of a manic episode. Mania is one of the hallmark features of bipolar I disorder. According to diagnostic criteria, a manic episode must last at least 7 consecutive days, or be severe enough to require hospitalization, even if it hasn't lasted a full week. But in the real world, mania often stretches beyond those clinical definitions. Without treatment, manic episodes can last several weeks to even a few months. During this time, a person might experience racing thoughts, euphoric or irritable mood, decreased need for sleep, impulsive behavior, grandiosity, and risk-taking. If left unchecked, mania can escalate into dangerous territory: financial ruin, damaged relationships, physical exhaustion, or even legal issues. That's why recognizing and intervening early is so important. With timely treatment, whether it's medication, therapy, or hospitalization, mania can often be shortened to just a few days or weeks. However, recovery from a manic episode doesn't happen overnight. After the visible symptoms subside, people often experience a period of exhaustion, confusion, or depression. This post-mania crash can last weeks in itself and may require additional support. Have you experienced a manic phase that spiraled or took months to recover from? Feel free to share your experience. It could make someone else feel less alone. Section 3. Hypomania, shorter but sneaky. In contrast to full-blown mania, hypomania is associated with bipolar II disorder. It's defined as lasting at least 4 days, with noticeable changes in mood and behavior, but not severe enough to cause hospitalization or major functional impairment. Many people with bipolar II don't even realize they've experienced hypomania, especially if the symptoms were pleasant, such as increased creativity, productivity, or sociability. Because of this, hypomania can often go undiagnosed or be mistaken for just a good week. Still, untreated hypomania can linger for a few days to several weeks, and often leads to either a depressive episode or a mixed state. What makes hypomania particularly tricky is its seductive nature. It feels good, which can lead people to avoid treatment or resist diagnosis. Tracking the length and impact of hypomania is essential. It might not be as disruptive as mania, but it can still destabilize your life, especially if it leads to impulsive decisions or precedes a crash. Section 4. The long haul of bipolar depression. Depression in bipolar disorder is not just a sad mood. It's a complete shutdown of energy, interest, and motivation. In fact, individuals with bipolar disorder often spend more time in depression than in mania or hypomania. A major depressive episode is defined as lasting at least 2 weeks, but in bipolar disorder, episodes often last far longer. Some studies show that bipolar depression can persist for 2 months to a year or more, especially if it goes untreated. Bipolar depression is also more resistant to treatment than unipolar depression. Standard antidepressants can even trigger mania or rapid cycling, which is why mood stabilizers or atypical antipsychotics are typically recommended. Living with prolonged depression can impact everything: work, relationships, physical health, and self-esteem. The longer the episode, the harder it can be to remember what normal even feels like. That's why support systems and structured treatment are so critical. Recovery may be slow, but it is possible. Each small step matters. If you've been there, or are there right now, know that you're not alone. Section 5. Mixed episodes, the emotional whirlpool. Mixed episodes are when symptoms of both mania and depression are present at the same time. Imagine having suicidal thoughts but also feeling agitated, energetic, and unable to sleep. It's an exhausting and dangerous combination. Mixed states can last a few days to several weeks, and because they don't fit neatly into categories, they're often underdiagnosed or mistaken for other disorders like borderline personality disorder or anxiety disorders. People in a mixed state may look functional but feel completely overwhelmed inside. These episodes can lead to the highest risk of self-harm or impulsive decisions. If you've ever felt like your mind is racing while your heart is breaking, you may have experienced a mixed episode. Sharing your story could help others feel validated. Section 6. Rapid cycling, when episodes move fast. Rapid cycling is a pattern where a person experiences 4 or more mood episodes in a year, but it can also occur more frequently, monthly, weekly, or even within a single day. Each episode may be shorter than average, but the frequency and intensity make this form particularly destabilizing. Rapid cycling is often linked to medication noncompliance, substance use, and certain medical conditions like thyroid disorders. Treatment for rapid cycling usually involves mood stabilizers like lithium or anticonvulsants. Psychotherapy and sleep hygiene are also critical. It can be exhausting, but many people do find relief with the right support and regimen. Section 7. Ultradian and ultrarapid cycling. Some individuals experience mood shifts even more rapidly. Ultradian cycling refers to mood changes within a single day. One morning you're euphoric, by afternoon you're depressed, and by evening you feel numb. It's disorienting and painful. These ultra-rapid shifts are not always officially recognized in diagnostic manuals, but they're very real for those who experience them. They often coexist with trauma histories, anxiety disorders, or personality disorders. This form is extremely challenging to live with and treat. It requires a highly tailored, often multi-pronged approach involving mood stabilizers, trauma-informed therapy, and close monitoring. Section 8. Factors that affect episode duration. So what determines how long an episode lasts? Genetics. A family history of bipolar disorder may indicate more severe or longer-lasting episodes. Biological rhythms. Disrupted sleep cycles can throw off mood regulation. Medication. Adherence to prescribed treatment can dramatically shorten episode duration. Life events. Trauma, grief, or high stress can prolong or trigger episodes. Substance use. Alcohol and drugs can worsen symptoms and extend episodes. Support. Social connections, therapy, and community support help reduce suffering and aid faster recovery. Understanding your personal triggers and patterns can empower you to take action earlier and build a wellness toolkit. Section 9. What recovery really means. Recovery isn't about being symptom-free forever. It's about managing symptoms more effectively, bouncing back more quickly, and maintaining functional, fulfilling lives. Some people go years between episodes. Others may always be managing shifts. Either way, there is strength in awareness, routine, and support. Therapy can teach coping strategies. Medication can provide balance. Friends and family can offer love. And self-compassion is the glue that holds it all together. Track your moods. Know your early warning signs. Celebrate every bit of progress, because recovery is personal and possible. Section 10. You're not alone. If you're in an episode right now, whether it's a slow descent into depression or a rapid climb into mania, know that this too shall pass. There is hope. There is help. And there is a whole community of people walking this road with you. Every story you share, every truth you tell, contributes to a world where bipolar disorder is better understood and compassionately supported. Take a moment, pause, reach out. You matter. If this video gave you clarity or comfort, please like, comment, subscribe, and share it with someone who might benefit. Help us keep building this community of awareness, healing, and support. Disclaimer: this YouTube video is for informational purposes only and does not substitute professional medical advice. Always consult with a qualified mental health expert for diagnosis, treatment, and support. Thank you for watching Bipolar Talks. Until next time, stay mindful and stay connected.